Recording.
My name is Hepsibah Gekombe. I'm a student, family nurse practitioner student from UTA, and today I'm going to perform a head to toe assessment. But before I begin, I will show my ID and scan my environment. It's my ID, and I'm going to scan my environment. That's my assessment area, and that's where my camera is sitting. In the floor. And those are my equipments right there, with my gauze and gloves. All right. I get it right?
Yeah.
Okay. Before I begin, I would like to introduce my patient for today. This is my patient, and yeah, you'll meet him shortly during introduction. And before I start, I have washed my hands. Okay. What's your name? Amon. What's today's date?
March 28th, 2017.
Okay. Where are we today?
At home.
Okay. I hope the volume is up. Okay, Mr. Beginning with mentation, Amon is alert and oriented to name. He knows his name and he knows today's date. He's also alert to place where we are right now. He's Mr. Amon, how are you feeling today?
Okay.
Feeling okay. His mood is concurrent with the affect. He's well dressed for the occasion. He maintains eye contact. He's able to communicate as well by telling me how he feels, where he is. So he's able to communicate. His communication skills are good. Beginning with the hair, before the hair, beginning with the skin. Mr. Amon's skin is dark in color. Looking at the legs, it's dark, uniformly dark. It's smooth in texture. Feeling for the temperature. His temperature is warm. I don't see any lesions. No edema noted. No lesions, no edema. Next, we are moving on to your nails. I want to inspect your nails. Inspecting, the nails are smooth in texture. They are pink in color. No signs of cyanosis. No bruising. They are short, well trimmed. I'm going to check for capillary refill on all 10 upper extremity and lower extremity. Capillary refill is less than 2 seconds, and also I'm going to check the skin tagger. Skin tagger is less than 2 seconds as well. Moving on to the hair. Emma's hair is short, well groomed, it's clean, it's black in color, it's curly in texture, it's equally distributed, no balding, no redness, no inflammation. I'm going to palpate your scalp. Any tenderness? No tenderness, no masses, no nodules. No nodules. Okay, next we are moving to the head and neck and the lymph nodes. Head is normocephalic in size. It's round in shape. It's held upright and still. There's no nodding, no tremors noted. Facial features. I have the nasolabial folds, the palpebral features. They're all symmetric with expression, and they're all at midline. Looking at the neck, inspecting. Can you tilt your head back? No signs of thyromegaly. The skin on the neck is symmetrical with the skin color. Thank you. Next, I'm going to palpate, beginning with the hyoid bone, the thyroid gland, cricoid cartilage, no nodules, no masses. Was that tender? No tenderness. Next, I'm going to palpate the trachea. No tagging the trachea, checking for midline. Trachea is midline. I'm not able to palpate for, the thyroid, so there's obvious no signs of thyromegaly. Next, I'll have you take a sip of the water. I'll tell you when to swallow. I want you to tilt your head back and swallow. The hyoid bone, cricoid cartilage slides up when the patient swallows. Take another swallow. Now I want you to hold it, please. Now I want you to swallow. Thank you. Take another sip. Thank you. Turn to the left. Swallow. When the patient swallows, thyroid gland is palpable. It slides upward. Was there any problem swallowing? No difficulty swallowing, no masses, no tenderness as well. Next, I'm going to palpate your carotid pulse on this side. Carotid pulse is present, 2 plus 2 amplitude. Next, I'm going to listen to your trachea as well as your thyroid gland. I will listen with the bell, beginning with the carotid pulse. I want you to hold your breath. Thank you. No breath. Hold your breath for a minute. No breath. Next, I'm going to listen on your thyroid gland with the bell as well. You can breathe on this side. No breath. No breath auscultated. Next, I'm going to assess your lymph nodes. I'll begin with the occipital lymph node, post-auricular, pre-auricular, supraclavicular, litropharyngeal or tonsillar, submandibular, submental, posterior cervical chain, anterior cervical chain, supraclavicular. Next, I will palpate your lymph nodes under your armpits. If you can take your shirt off. Thank you. Just this way. Axillary. And this side. Axillary. Thank you. Epitrochlear. Epitrochlear. Was any of that tender? No tenderness, no palpable lymph nodes noted. Next, I'm moving on to your eyes. Patient's eyes, you can put your shirt on. Inspecting the eyes, can you close your eyes for a little bit? Thank you. You can open them. When the patient closed the eyes, I don't see any tremors on the eyelid. Don't see any signs of ptosis on the eyelid. No crusting, no drainage. Eyelashes are clean. The sclera is white. The lenses are transparent. The iris is brown. The pupils are dark and equal in size. Next, I'm going to palpate and feel your eyeball. Was that tender? No tenderness on the eyeballs, no nodules noted. Conjunctiva is pink with no redness, no swelling. Going to palpate the lacrimal gland, and then I will look into the lacrimal gland. Pink and moist. Lacrimal gland pink and moist with no redness, no crusting, no drainage. Thank you. Next, we are going to look into your eye using the ophthalmoscope. And I will use my right eye to your right eye, looking for a red reflex. I've established the red reflex going in. The optic disc is sharp and well defined. The fundus is dark in color. I didn't see any signs of hemorrhage, therefore the presence of blood vessels is not noted, not present. Moving on to this side, left eye to the left eye. I will focus from the side. I've established the red reflex going in. Optic disc is sharp and well defined. The fundus is black in color, dark in color. No blood vessels noted that may indicate hemorrhage as well. Next, we are going to do the test your pupil, how they respond to the light. The pupils are equal round. They react to the light by constricting. Next, I'm going to test for corneal light. I will shine the light at the bridge of the nose. The eyes reflect symmetrical into both bilateral eyes, which shows balanced extraocular muscles. Next, I'm going to do the cover and uncover test. I want you to focus on the wall, that point above my shoulder, and ready go. No movement of the eye, no sudden eye movement that may indicate astigmatism. No eye movement noted as well. Next, I'm going to do the extraocular movement into 6 cardinal fields. So I want you to look at that point again. And I want you to move your eyes, but do not move your neck, your head. You ready? Okay. Six cardinal fields, no sudden movement of the eyes, patient able to move eyes into all those areas. Next, we are going to do direct and consensual. Shining the light. This eye directly constrict and the other one consensually constrict. Left eye directly constrict and the other eye consensually constrict. Next, um, I'm going to explain to you about the Snellen chart and Rosenberg chart. We have those are the two different types of charts we have to check your visual acuity. The Snellen chart will determine your acuity of far vision. We'll have it at 20 feet on the wall, and I'll have you cover one eye, read the smallest line, and cover the other eye, read the smallest line possible, then read with both eyes uncovered, and that will determine your visual acuity. Next, we have the Rosenberg chart that is held at reading level, comfortable level. You will cover and cover, read and cover the other eye, read and cover, then cover with both eyes uncovered, and that way will determine your near vision acuity. But we are not going to test that today. And what I can say, I just completed cranial nerve number 2, optic, and that's what I just completed. And the cranial nerve number 2, it's a sensory, is intact. Next, moving on to your ears, inspecting. The ears are in line, the earlobes are in line with the top of the auricles is in line with the inner contours of the eye. The color of the earlobes is consistent with the rest of the skin color. I'm going to palpate. Auricles and earlobe mastoid process. And of that tender, no tenderness, no nodules, no swelling noted, no pain as well. Next, we'll look into your eye, into your ear with the otoscope. And I'm going to look into your auditory canal and the tympanic membrane. Those are the landmarks. Okay, look this way. I have my otoscope here. I'll pull the auricle back and up as an adult, and pressing with my pinky, going in. Auditory canal is pink, no blockage, no drainage. Tympanic membrane is pearly gray in color. Cone of light is at 5 o'clock. No redness noted. I'll change my speculum and inspect the other ear. And pulling the ear back and up, raising again with my pinky, and going in. Auditory canal is pink in color. The tympanic membrane is pearly gray. Cone of light is at 7 o'clock. No drainage, no blockage, no redness noted. Next, we are going to do a whisper test. I want you to block your other ear. I'm going to call something. I want you to repeat what I said.
Ice cream.
That's correct. Ice cream.
Pillowcase.
That's correct. Pillowcase. Hearing is intact with whisper test. Next, we are going to do the wafer test. I will strike it, and I want you to tell me if you hear it on the left or on the right. You ready?
Both.
Both ears. Thank you. Next, I'm going to put this at the back of your ear. Let me know when you no longer hear the vibration. You can face this way. You ready?
Mm-hmm.
And I will time it. No more? Okay. We'll continue timing. conduction was greater than bone conduction at a rate of 20 to 40. Okay. Hearing is intact, and cranial nerve number 8, acoustic, its sensory, is complete at this time. It's intact. Next, we are moving on to your nose, inspecting. The nasal bone is at midline. The skin color is consistent with the rest of the skin. Palpating. Is that tender? No tenderness, no masses, no nodules noted. Then I'm going to inspect your nose and get a clean speculum with the otoscope as well. And I'm going to look inside your nose. I'm bracing with my pinky again. Looking into the nose, nasomucosa is pink. The turbinates are deep pink. The septum is at midline. No polyps, no blockage, no redness, no swelling noted. I'll change my speculum. Again. Bracing, going in. Nasomucosa is pink. The turbinates are deep pink. It's clean, no redness, no polyps noted, no swelling, and the septum is at midline. Thank you. Next, we are moving on to your mouth. Inspecting the lips are symmetrical. No redness noted. Palpating. Is that tender? No nodules, no redness, no tenderness as well. Let me look into your gums. I'm going to palpate your gums. The gums are pink in color. Palpating. No nodules noted, present, no redness. Let me look at your teeth. The teeth are pearly white, no caries noted, and counting the teeth, patient has all 32 teeth, soft palate and has hard palate is pink, no redness. Let me look under your tongue. The floor of the mouth is pink. The frenulum is at midline. Thank you. No redness, no swelling. I want you to stick your tongue out. The tongue is in midline. No redness, no scarring. Say ah. Thank you. The uvula is at midline. The soft palate is able to raise and still remain at midline. The tonsils, no projection of tonsils past the tonsillar pillar, so no swelling as well. Next, we are moving to your chest. I want you to remove your shirt. Inspecting the chest, no structural abnormalities noted. Skin color is consistent with the rest of the skin color. AP diameter is half the size lateral diameter as well. Okay. I'm going to palpate your chest. No masses. Okay, next I'm going to percurse, beginning from here. I'm going to percuss 10 areas in the front. I'll start again, sorry. I hear resonance on the line fields. Four on the side, resonance. I hear resonance. Now I will percuss the back. And I will percuss 10 places. I hear resonance on all the line fields. Next, it's okay. I'm going to feel for tactile parameters at the back. I want you to say 99 each time, but I want you to put your arms together and do that, okay?
99, 99, 99, 99, 99.
Thank you. Tactile parameters are present, and I'm going to listen to the back so I can minimize patient movement to preserve energy. And I will listen with the diaphragm. I want you to breathe in and out at your comfortable pace through your mouth. Ready? Okay. Still put your arms in. Okay, ready? Go. And I'll listen to 10 places. Thank you. Then I will listen on the axillary area to 4 places. Keep breathing. Thank you. Now you can turn around. And I will listen on this side. Axillary area. Before I listen to the front, I will want you to say 99 again. You ready?
99, 99, 99, 99.
Tactile parameters present. Now I'm going to listen to the anterior portion of the lungs, and I will listen to trachea area first with the bell. Take deep breaths in and out through your mouth. I hear bronchial breath sounds on the trachea area. Moving on to the main bronchi. I hear bronchiovesicular. Then moving on to peripheral lung fields. I just listened to the 8 places on the front surface. On the trachea area, I heard bronchial breath sounds. Expiration was greater than inspiration. Main bronchi, I heard bronchiovesicular breath sounds. Inspiration is equal to expiration. In the peripheral lung fields, I hear vesicular breath sounds where inspiration is greater than expiration. Next, at this time I could also listen to the whole place, same sequence with the bell as well, but we are not going to do that today. Now, looking at the patient's respiration rate, at this time I'll count respiration for 1 full minute, and also, but we are not going to do that today. I will also assess any use of accessory muscles. I don't see any. Patient breathing is effortless and smooth. Chest rise and fall symmetrically with no paradoxal movement. Next, we are moving to your heart, inspecting the heart area. The skin is consistent with the rest of the skin. I don't see any pulsation, no thrives, no heaves, just by inspection. Next, we are going to the bed, and I'm going to assess your heart while you're laying down. I'm going to palpate your precordium and the apical area. Palpating precordium, and at this time I will count the apical pulse for 1 full minute, but we are not going to do that today. No thrills, no hips palpable. Okay, no pulsation noted. No jugular vein distension noted as well when the patient faces the other side. Okay, thank you. You can sit up. Now I'm going to evaluate your valves or heart sounds. Come sit on the chair. Listening to heart valves, I'm going to use the bell because I'm going to use the bell. I prefer using the bell because it transmits high frequency sounds, and also it covers a broad surface area of the heart as well, of the sound. Starting with aortic valve, second intercostal space, right sternal border. S2 is greater than S1. Pulmonic valve, second intercostal space, left sternal border. S2 is greater than S1. Second pulmonic or Erb's point, third intercostal space, left sternal border. S2 is equal to S1. Tricuspid valve, fourth intercostal space, left sternal border. S1 is greater than S2. Mitral valve, fifth intercostal space, mid clavicular line. This is also the point of maximum impulse. S1 is greater than S2. At this point, I will listen to a heart rate for 1 full minute, but we are not going to do that today. The rhythm is regular. Heart rate, I did not count. No splitting sounds, no murmur. I will also listen to all valves with the bell as well, but I didn't do that. I'm not going to do that today. Okay, and assessing the heart, I will assess when the patient is sitting, laying supine, and laying left lateral. Okay, moving on, we are going to assess your stomach, and I'm going to have you lay down. Okay, assessing the stomach at eye level. Motion is smooth. The stomach is symmetrical, looking from the head section of my patient. I want you to raise your head up like that. Thank you. No bulging noted. The skin color is consistent with the rest of the skin color. Patient breathing in and out very smooth, no bulging as well. No venous pattern noted. To begin with, I'm going to listen to your bowel sounds. Right lower quadrant, left lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and I'll listen to epigastric area with that bell. Bowel sounds present to all 4 quadrants. Next, I'm going to percurse. Percurse to all 4 quadrants. In the epigastric area, I hear tympani on all 4 places, and gastric purpose on the epigastric area. Next, I'm going to percuss and measure the liver span, mid-clavicular line. I'll start from the umbilical area. I hear change right here. Then I'll start from up here. I hear change right here. And then I'm going to measure the liver span. In inches, starting from 1. The liver span is approximately exactly 6.5 inches. Sorry, it's in inches, 6.5, which is normal because the normal liver is 6 to 12 inches. Next, I'm going to percuss for the spleen. Make sure that spleen is not enlarged, and I will percuss lateral. No enlargement of the spleen noted. Next, I'm going to palpate lightly and palpate deeply, but we'll start with light palpation. Let me know if you have pain. To 4 quadrants. Was that painful?
No.
No. Okay. Next, I'm going to do deep palpation. No pain noted, no masses. It's smooth, palpable. Next, I'm going to check for a Murphy sign. So I want you to breathe in and out like. Ready? Again. Again. Murphy sign is negative. This is to check if the spleen is enlarged or there is pain. The gallbladder, sorry, if the gallbladder is enlarged or there is pain. But when the patient was breathing in and out, no halting of the respirations. Next, I'm going to palpate for your liver. Just keep breathing. Keep breathing. I'm not able to palpate the liver. Okay. Keep spleen. Not able to palpate the spleen either. Next, we are going to check for costovertebral angle tenderness. I'll have my patient face that way, like that. Keep moving. I want you to tell me if you feel pain. You ready?
Mm-hmm.
Was that painful?
No. No.
Painful? No tenderness reported. Thank you. You can come and sit. And, excuse me. You can sit.
No.
Thank you. You can sit. Come sit here.
Okay.
Now, before we proceed, I'm going to check for your blood vessels. We'll start with the temporal pulse, then brachial pulse, then radial pulse, your feet, posterior tibial, pedal pulse as well, pedal pulse. Okay. All pulses palpable to all areas. 2 plus 2 amplitude. Thank you. Okay. Next, we are going to do the musculoskeletal system. I want you to stand and have a walk that way and come back. Okay, stand right there. The gait is balanced. The posture is straight and symmetric. Posture is straight and symmetric. Now put your legs close together and close your eyes. I'm checking for lumbar sign. Thank you. You can open. Patient was able to stand upright without loss of balance for 5 seconds. Lumbar sign is negative. Next, I want you to bend forward. I'm screening for scoliosis and touch your toes. Here goes. You can stand. No lateral curvature noted. Scoliosis is negative. Thank you. Have a seat. Now we are going to do range of motion. Starting with the cervical area. I want you to bring your chin to your chest. Now extend all the way back. Now I want you to bring your left ear to your shoulder. Don't move your shoulder. Now to the right. Thank you. Now I want you to rotate your head all the way to the left as far as you can go. Now to this side. Thank you. Range of motion is full. Moving on to your elbow. Want you to flex your elbow. Now extend. Palm facing down. So pronation, facing up, supination. Thank you. Flexion, extension, pronation, and supination. Full range of motion. Next, we'll do your shoulders. I want you to raise your arms up. Now bring all the way down. Up, down, okay. Backward, thank you. Now I want you to, abduction, then bring it all the way. Adduction, you want to stand? Stand. Okay. Now raise up. We'll start again. Hold down. Okay. I want you to extend back. Thank you. Flexion, extension. Now I want you to go on the side. Abduction. Abduction. Now bring it all the way to the side. Adduction. Do the other one as well. Abduction. Bring it all the way up. Adduction. Now I want you to bring your arms to the back like this. Internal rotation. Now bring it up on your shoulder. External rotation. Range of motion is full as noted. Next we'll do your legs. I want you to fold your knee. Flexion. Extend it all the way. Extension. The other one. Flexion. Extension. Okay. You can sit. We're going to do the ankle. I want you to point down your ankles as far as you can go. Plantar flexion, bring them up as far as you can. Okay. Dorsiflexion, bring them in. Okay. Inversion, now bring them out. Eversion, now I want you to scoop like that. One at a time. You can do one at a time. Like this. Internal, okay. Bring it in. Okay. Adduction, bring it up. Abduction. This one, bring it in. Adduction, bring it up. Abduction. Okay. Let's do your wrist. Want you to flex it down. Flexion, now up as far as you can go. Extension, bring them in. Internal rotation, inversion or internal rotation, now out. External rotation or eversion. Okay, that's good. Now we're going to do your hip. I want you to go back to the table. Okay, you can raise your hip as far as you can go. Hyperextension, and the other one. Hyperextension. Okay, lay on your back. Now raise your leg up as far as you can go. Flexion. Now bring the knee up to your chest. flexion. Now I want you to move the internal rotation, then bring the knee out as far as you can go. External rotation. Let's do the other one. Raise it up. Flexion, knee flexion. Want you to bring your knee to your chest. Knee flexion. Then bring the knee inward. Internal rotation. Now take the knee outside. External rotation. Okay. Now I want you that leg to go as far as you can go out. In. Okay. Adduction all the way out. Abduction. And the other one. Adduction all the way out. Abduction. Okay. While you're laying that way, I want you to I'm going to perform the range of motion on your wrist. So flexion, extension, internal rotation, external rotation, and this is a passive range of motion. Flexion, extension, internal rotation, external rotation, or inversion, eversion. Okay, thank you. Full range of motion of all extremities. Before you get up, I'm going to do what is called anterior drawer test. So lay down, and I want you to put
Can
this
see
here.
the camera.
Huh? Okay.
Are
You ready? Yeah, I'm good. And I will sit on his foot, and I will pull it up like that. Anterior drawer test is negative, and this one as well. And anterior drawer test is negative. Okay, come on. So now we are going to do the neurologic cranial nerves. Okay. We checked cranial nerve number 2. We checked the vision. Now cranial nerve number 3, 4, and 6, oculometer, trochlea, and abducens. It's intact. As evidenced earlier, we checked eyes for eyelids for ptosis. We also checked the pupils. They were equal round and they were reacting to the light. We also checked the visual acuity. We explained about the Snellen chart. Next, cranial nerve number 5. It's a trigeminal. I want you to tighten your jaw. The muscle tone on the face is symmetric with fasciculation, and then we are going to check for this is sharp, this is soft, this is dull, and this is soft. Okay? I want you to close your eyes and tell me.
Dull. Dull. Sharp. Sharp. Soft. Soft.
Thank you. Cranial nerve number 5, trigeminal. It's motor and sensory. It's intact. Cranial nerve number 3, 4, and 6, oculometer, trochlea, and abducens. It was motor and sensory as well. Okay. Cranial nerve number 7. It's facial, and it's motor and sensory. I want you to make faces on your face. So I want you to smile without showing your teeth. Now smile with your teeth showing. Puffy your cheeks. Whistle. I want you to frown. Okay. Raise your eyebrows. Okay. Thank you. Facial movement is great. Do you have a problem differentiating between sour and sweet? No. Cranial nerve number 7 is intact. Cranial nerve number 8, acoustic. It's sensory. It was tested early with hearing, and it was intact. Cranial nerve number 10. It's glossopharyngeal. And vagus nerve, cranial nerve number 10. It's sensory and motor. It was tested early. The uvula was at midline. Okay. Soft palate was at midline. It was assessed early as well. And we usually do the gut reflex, but we are not going to do that. So cranial nerve number 9 and 10 is intact. Next is cranial nerve number 11, spinal accessory, and we are going to check for sternocleidomastoid muscle strength. So I want you to shrug your shoulders. Don't let me push you down. Okay, thank you. Face to the left, resist my push. Okay, push. Okay, thank you. I want you to face down. Don't let me. Okay, now face up. Thank you. Spinal accessory, cranial nerve number 11. Motor is intact. Next is cranial nerve number 12. It's hypoglossal. And I want you to stick your tongue out. Tongue is midline. Move it to the left. Now to the right. Okay. Touch your nose. Try to touch your nose. Now try to touch your chin. Okay. Now push it on your buccal area. Now this one. Do you have any problem with salty, testing salty and sour? No? Okay. Cranial nerve number 12, hypoglossal. Its motor is intact. Okay. Next, we are going to do coordination. I want you to pat your hands like that. Faster. Thank you. Next is your nose. I want you to touch your nose with your index finger. Close your eyes. Alternate. Thank you. Coordination is great. Thank you. Next, we are going to do sensation. So remember the sharp, dull, and soft. I'm going to touch you, and I want you to tell me. Ready?
Sharp, sharp, soft, soft, dull, dull.
Thank you. And we're going to do a vibration. Oh, I'm going to strike. I want you to tell me where you hear the vibration. You ready?
Right wrist, left elbow.
Okay. Now I want you to tell me where you hear it and if it's vibrating. If it's vibrating or not. You ready?
Left toe, no vibration. Right ankle, no vibration.
Okay, great. Thank you. Lastly, we are going to do a check for tendon, deep tendon reflex. I'll start with here. Tricep muscle. Okay. Bicep muscle. Okay. Hyperextension of the forearm, then biceps. Okay, flexion of the forearm. Flexion of the forearm. Now brachioradialis. Pronation and flexion of the forearm. Brachioradialis. Pronation of the arm and flexion of the forearm. Next, we are doing the patella. Hyperextension of the lower leg. Hyperextension of the lower leg. Now the Achilles tendon. Make sure it's visible on the computer. Plantar flexion on the leg. Plantar flexion. Lastly, I'm going to check for your plantar reflex. Plantar flexion of the toes without fanning. Plantar flexion of the toes without fanning. Well, that marks the end of our assessment. Thank you.